Thank you, Meg. Dr. Nina Ashford is a clinical assistant professor at the Tufts University School of Medicine. She's also a policy unit lead for the Center for Black Maternal Health and Reproductive Justice. Dr. Ashford, we appreciate your time. The March of Dimes says the Midwest and the South are the most affected by maternal care deserts. We just heard the doctor in that story saying money is a big reason why. So why does geography matter on this issue?
Well, when we think about these geographies that are being impacted the most, the South and the Midwest, and particularly rural communities, you have this perfect storm. So one big driving factor is that Medicaid covers over 50% of the births in these communities. And we know that Medicaid pays less than what we see in terms of reimbursement from private insurers. They also have a higher proportion of uninsured individuals who don't have the ability to pay because in the United States, we still do not have access to universal health care. When you couple that with the provider shortage issues we're seeing that were exacerbated by COVID-19, when we see providers that are leaving the market, and you couple that with the low volume of births that are happening in these communities, the business case is just not there. So hospitals are having to make very difficult decisions about how do we keep our bottom line stable if we have to save our emergency department, but that means we have to get rid of our labor and delivery department, well, then that might be part of the calculus that they're trying to make. But at the end of the day, the business case is just not making sense in these communities. And so unfortunately, we are seeing these maternity care deserts continue to increase.
So it's like problem after problem after problem. What about the fall of Roe v. Wade? In what ways did that impact this maternal care crisis?
Yeah, so we're actually going to see the fall of Roe v. Wade exacerbate the maternal crisis and actually exacerbate the broader maternal mortality crisis that we are seeing in this country. So, you know, it's estimated that Roe v. Wade is going to lead to an additional about 160,000 births each year. We know that because of these increased births, we're going to see an increase in miscarriages, premature births, and pregnancy complications. This is going to increase the demand of obstetric services. And when we see that 9% of maternity care deserts, are actually in states with restrictive or state policies that restrict abortion access or severely limit abortion access, this is going to continue to exacerbate these outcomes, unfortunately, and moms and babies are going to bear the brunt of these negative outcomes because they simply don't have access.
Meantime, some are touting telehealth as a possible solution here, but that faces its own tech challenges, especially in rural areas where internet access isn't that easy. What are the best options for those in maternal care deserts?
Yeah, so telehealth is definitely being touted as a big solution to this very big and ever increasing problem, right? But as you mentioned, it's not without faults, right? You have to have good broadband access and good infrastructure to be able to use telehealth services. Other options that are being touted are mobile maternity clinics. So thinking about how do we bring the services to the people that need them, and also thinking about innovative models where we have group prenatal visits. So you can try and get a number of birthing people together in the same spot and maximize a provider's time. There's also been lots of different opportunities looking at how do we expand birth centers, which are a safe and effective option for birthing people to give birth. How do we expand these to rural areas? And what are some of the regulatory and policy levers that we need to address so that there are not barriers for birth centers to be able to operate in these communities?
You had mentioned those mobile units. There's actually been some activity on Congress to push for this. What would that look like? Is that doctors, nurses, healthcare professionals coming to the affected communities?
Yeah, so that is taking your suite of services, right? For anybody that has birthed a child, you know that the monthly prenatal visits are pretty routine. There might be some brief labs that are done. There is listening to the fetal heart rate. There's collecting weight. All of these things that can be done in a mobile setting by a trained professional. So actually bringing these services to individual homes or even a community-based setting within that community. Maybe there's a local community center where they can serve multiple women at the same time. But that's exactly it.
Such an important topic. We appreciate you coming on to shed some light on it. Dr. Nina Ashford, Clinical Assistant Professor at the Tufts University School of Medicine. Thanks so much.
Thanks for having me.